Heather Craft, and for week 2, discussion 2, I will be representing one of the jurors in case number 3, the impermissible disclosure of protected health information in response to a subpoena. The defendant in this case is AU Hospital, and the plaintiff is Jennifer. After reviewing the case presented by both the defendant and plaintiff, I have found that AU Hospital is in fact guilty of disclosing protected health information by failing to ensure that the plaintiff had in fact received notice or request made by the third-party agency requesting her medical records before the information was disclosed. After reviewing the Medical Risk Management Advisor, I have discovered that the laws surrounding the health insurance portability and accountability, otherwise known as HIPAA, will allow for information to be released without a court-ordered subpoena. However, these rules are very strict and limited and are only permissible if responsible efforts have been made through using a health insurance portability and accountability protective order or through the health insurance portability and accountability notice requirements. The physician in charge of disclosing information should have received copies of correspondences showing an attempt to provide written notice to the patient from the party issuing the subpoena. The notice sent to the patient should have included all the pertinent information being sought after in their medical records. It would have also needed to explain how to issue any objections the patient may have to all or portions of the information requested from their medical records. Then only after written notice to the physician shows the patient's objections or resolutions to any objections that were made to any portion of their health record, then the patient's records may be released to the third party. Without being able to supply this documentation, then the physician should not disclose any information. The defendant, AU Hospital, has failed to produce any documentation to prove that these requests were made of the plaintiff. Therefore, they are in direct violation of the Health Insurance Probability and Accountability Act. No information is provided to determine if the state or HIPAA laws outweigh each other in this case, and so we're determining that that is non-admissible in this case, and therefore will not factor into the decision made by the jurors. Any information disclosed about the patient without the use of a court-ordered subpoena or specific authorization directly from the patient can be released when asking for certain medical conditions such as sexually transmitted diseases, drug and alcohol abuse, as well as any psychological care. If these were in fact released from Jennifer's records without the notice of the patient, then the hospital is in direct violation of her HIPAA rights. Due to the infractions surrounding the private healthcare information, in the past, healthcare organizations at all levels have developed a zero tolerance for breaches in patient confidentiality. There really is no difference in the lack of securing a protective order, and the proper authorization from Jennifer is no different. Since healthcare officials take a zero tolerance approach on unauthorized release of personal information, then this court will uphold that as well. The juror finds AU Hospital to be found guilty and should have to pay all restitutions to the plaintiff if due in this case. Thank you.